first of all, everybody says, who can blame our nurses, di ba? If they go for greener pastures. And not just the greener pastures, everybody also acknowledges poor working conditions here at home. So that out of the way and that acknowledged for everybody involved, what do we do exactly? I mean, if even acknowledging that if we just leave it all to, even if we were to improve working conditions here, if we just leave everything to a free market for our nurses, di ba? Parang it will take a long, long time before we catch up to that market. No? So how do we intervene? What's realistic in terms of packages and benefits that we can offer our nurses right now?
I think there's no argument that we really need to start thinking of how we can raise the benefits of the healthcare workers in general. We're now just talking about the nurses, but there are also other problems, as far as the health workforce is concerned. One of the other problem will probably be in terms of like the presence of sufficient number of physical therapies. Even that we are still lacking. The sufficient number of respiratory therapies, we are also lacking on that particular field. So it's not just about the adequacy of the nursing staff, but the other health workforce as well. And the glaring problem really is the low pay that majority of the healthcare workers are receiving. So, and this is primarily from the private hospitals. No, in government hospitals, I think it's sufficient enough, for the others to stay. But then again, even with the higher pay in government hospitals, nurses are still leaving, going for greener pastures because, the call for better opportunity is higher in the US and in the European countries like in UK, and even in Australia. So really, I think government must really do something to ensure that we will have enough workers to be left in the country to take care of the Filipinos.